Dr. Zayd Ratansi, one of my favorite people in the game. Welcome.
Hey, mister, thank you so much for having me.
And Dr. Zayd, you are going to grace us with 3 of your health tips for 2025. And the first one on your list is sleep hygiene. Tell us about that.
Huge. Your body recovers, regenerates during sleep. During the day, your body degenerates. You know, you're doing active sympathetic day-to-day, and you are not in recovery mode.
Okay.
You are in metabolic mode.
Get shit done mode.
Get shit done. So there's a net effect, right? And as you age, if you get more degeneration than regeneration, you slowly start getting a net delta of degeneration until, if it's the knee, bone on bone, we say, I got degenerative disease. So what do we need to do is sleep more and get really good sleep.
So you have a couple sleep hygiene tips as part of that.
Well, start getting accustomed to finding a timeline to go to bed. I like going to bed early now and waking up early. So before going to bed, make sure that you're not stimulated. A lot of times we have these bright blue, you got your phones and all that stuff.
Sure.
Take that out of your room. Your room should be...
No electronics in the bedroom.
Nothing. Just black.
Dark.
Easy. Dark. Yeah.
Cold.
Cold, nice, so your body gets into sleep. Make sure your last meal was like a few hours before. So you're done. You're ready to go to bed.
Your body's ready in recovery mode.
And then when you wake up, you can do first morning light therapy, blue light therapy, sunlight therapy. And after about a month of getting your body trained on that, you start getting into this rhythm. Right?
A nice, healthy circadian rhythm. Okay, that's good.
D, okay. Yeah.
So your second one, Zayd, was hypothermia. Tell us about that.
Heat. I love it. Yeah.
I do too, by the way. I'm a big sauna junkie.
Saunas. I like
hot tub junkie.
Hot tubs.
Steam sauna junkie.
Steam saunas. I do mud baths. Everything.
Yeah.
And what it is imagine you're in a heated environment and you raise the body temperature just a little bit and you're not moving. What happens when your body temperature raises? Your immune system gets activated. What happens when your body temperature is down? Your body isn't metabolizing as well.
Yeah.
But what else is happening? You're inviting more viral activities, like invading organisms. They do better. Your immune system doesn't. So what do we want? We want to increase the temperature, get your immune system active. But then what happens is your heart starts pumping. You're actually building your cardiovascular system.
Just sitting there.
You're exercising your heart and your blood flow.
And you're activating the immune system. And you're raising temperature.
Yeah.
So there's all these benefits just from hypothermia. I love it.
And so that heart and that circulatory pathway, then what happens with heat? Fatty tissues start releasing more chemicals and toxins. Guess what happens? As it gets in the bloodstream, you're now sweating. You're sweating out.
So now you're detoxifying as well.
So
well, we all need that, Dr. Zayd, because we have so much garbage in our environment nowadays, and we need ways to get
and it's not
microplastics and chemicals and
those microplastics,
metals.
It's not just through the sweat, because now you're getting more going into the liver, into bile for bowel movements, and into kidneys for urine. When you're in that heated environment, your volatile chemicals are excreted through the lungs. So it's a full body excretion of all these harmful chemicals.
That's why we feel so good when we come out of these sauna sessions.
But here's the thing. When you're in the sauna, typically, wow, I feel great. I'm in for 20 minutes. You know what I do? I like the infrared saunas.
Yep.
Or any type of sauna you could stay in longer. And now you start getting the extra 20 or 30 minutes of cardiovascular exercise, and you're getting more chemicals out of the body.
That's a fantastic explanation of the benefits of heat.
Yes.
Now, number 3, Zayd, we could talk for 3 days on number 3, because I know you have so much expertise on this matter. 5, yeah. Oxygen therapy.
Absolutely.
Yeah.
Absolutely. We are living in a hypoxic, ischemic environment. And what happens as we age, blood vessels get narrow and we start getting cardiovascular disease. And what I like recommending is hyperbaric oxygen. Hyperbaric, pressure, breathing extra oxygen. What happens is that extra dose of oxygen goes into the liquid plasma, not on the red blood cells, but in the liquid. So you're sitting in this hyperbaric chamber, which is now becoming readily available.
Absolutely.
For patients.
Yeah.
It never used to be, but now it is. You sit, you don't do anything, you breathe normally, and you're dosing more oxygen in the bloodstream, getting to metabolically active tissue, and now our body starts creating new tissue, new blood vessels.
Wow.
What a great thing to do for 2025. Get
Better sleep,
better sleep.
hypothermia, oxygen.
That's hyperthermia.
Hyperthermia.
Keep that.
Better sleep,
Hyperthermia, more heat.
oxygen.
Yes.
Zayd,
Gotcha.
thank you, man.
Awesome.